Hi everybody, it's Jared, and today I'm with Blake Adair-Roberts, who has been in control of our Allied Health campaign and also the hearings that will be coming up shortly. As you know, a lot of work has been done in relation to the work value cases that are coming forward. You may well be of the view that it's been a little bit quiet, but it hasn't been from the viewpoint of the union and also our delegates and indeed Blake and his team. I can tell you now that we've put in to the Commission approximately 20,000 pages of evidence, an enormous amount. This union has never done anything like this previously, and it'll be a long time before we get to do it again. So the point of the discussion today is actually to bring you up to speed of where we're at, where we're going to, and what are the timeframes in relation to that. So welcome, mate. Thank you for all the hard work. I know you and your team have been sort of really working 7 days a week, nearly 24 hours a day, and it's taken a drain, but how you're coping?
Yeah, we're coming good now. I think it's one of those things that in hindsight, if you knew what you're getting yourself into, you probably run for the hills up front. But now that it's done, it's quite an incredible feeling to have achieved a significant amount of work. And as you said, probably won't be done for a long time. To the best of our knowledge, it hasn't been done before, this scale. Bringing together so many awards, filing over 100 member statements, a range of expert statements, the size of the evidence and the claim that we're putting forward is more than once in a generational. From what we can tell, it is one of the few times it's ever been done in this jurisdiction. So yeah, definitely coming good now after a few good sleeps.
And so how many in the team have you got?
So we had 7 in the team in total, in the Allied Health team. And then we had 2 doing the core conditions work. An amazing team of barristers as well supporting us, and we have Dennis Ravlich assisting as well, who has been involved with Allied Health since they came into the HSU in the late 90s, early 2000s.
I know it's a passion for Dennis to get it right. When we do say there's 20,000 pages of evidence, that's no exaggeration, is it?
No, although I haven't counted every single page. We're confident it exceeds that. To give a kind of some specifics, there's about 91 member statements from Allied Health members alone around the value of their work, what they have been doing over the last 20 years, the changes that have occurred, and not just looking at it individually for each occupation. And that's what's quite different to what we've done in the past. Is historically with the work value, you'd pick a cohort, you'd pick perfusionists, you'd run a few witness statements for them, you'd really focus on the work that they do. What has occurred here is that we've done the entire spectrum of allied health and health professionals within the health system, every single cohort, and not just looked at what do they individually do, but as an entire collective. How do they treat patients? How do they make sure patients stay out of hospital? How do they provide preventative care? And also, how have they moved out from, I guess, a subordinate position from medical and nursing to now being the front line that patients deal with in every scenario and situation that may occur. So, instead of a physiotherapist just being referred by a doctor for some treatment post-surgery, looking at how a physiotherapist is now on the front line of emergency departments, triaging and working with patients. And what does that flow and effect have? All of them have stepped up. And it's a bit of a, the sum of their parts are greater than their individual work. So from that perspective, it's massive. There's around a dozen expert statements from experts in their particular field, talking about everything from the economics of the New South Wales government through to sleep and fatigue, through to profession-specific components, gender undervaluation. And that's a really important part of this process, is saying that all of this work is fantastic, all the changes, but at the same time, many of these occupations are women-dominated professions and that they haven't been valued for the invisible skills that they bring into this work. It's not just being empathetic and being trauma-informed and practicing in that way. These are actual skills that haven't been valued for decades and decades in the healthcare system.
It's quite clear. It's 45 awards and condition and determinations been brought into virtually one.
Yeah.
So it's a massive amount. So in terms of the evidence, what sort of type of evidence has been put in, and I guess the range of people are putting evidence in?
In terms of the range, we really tried to leave no stone unturned. So, we've got graduate professionals who are in the first year or two of their career, all the way through to members who've quite literally worked for half a decade and have seen the healthcare system change and evolve in that time. In terms of the cohorts, we have at this stage, for the first time ever, covered all of our groups at one time. Even the small professions that in the past have maybe not had a chance to do work value because of their size. The economy of scale of this case means that we've been able to do that. So groups like radiopharmaceutical science and lived experience workers that have never had a work value assessed have been brought. And at the same time, we've looked at making sure there's a good spread of regional and metropolitan, not just focusing on the big hospitals, looking at community health, looking at workers that are doing outside of the ordinary as well as the ordinary, and making sure that we're not just tailoring this approach to one cohort, but rather looking at all of our members being brought in together through this process. In terms of the evidence, it's an interesting process. For each member, they will have a story to tell, and that story tells a part of what their profession has gone through over the last 20 years. So in a very high level sense, what members have spoken about is how their work has changed. And what that change means, not just for patients, but in terms of the skill, the responsibility and the knowledge that a particular professional has to have when they come into work, because that is just night and day to what it was in 2007. The other parts which I've spoken about is gender undervaluation and those invisible skills, the spatial awareness, working with patients in the most difficult moments of their life and managing those situations really skillfully and making sure the patients are cared for, families are cared for, children are cared for in the appropriate way. And the other big part of this, which I don't think has really been done before, is looking at the productivity of our membership, but also the productivity coming from a new award, which brings all 45 groups together, not looking at having 15 different grading committees, but saying, well, how can we get one structure that applies to everyone? So really for us, it's about saying the work has changed, there's a gender undervaluation aspect, and there's a productivity benefit for the entire community. And that's a really key element here is, we know from the Special Commission of Inquiry that we need to do more with the health funding that is in place. We need to focus more on preventative health. We need to find ways to get people out of hospital and keep them out of hospital. And the best people to do that is Allied Health. That is their bread and butter every single day. So we need to recognise that productivity in the new awards that are made.
And so the next steps, we will be having hearings later this year. So you've got a time frame in those?
Yeah, we do. So for the next few months, we're in the stage of what's called reply evidence, where both sides will be reviewing each other's evidence and replying to that. That lasts for about 3 months until October 22nd. Then there is a reply evidence for about 2 weeks. That'll be another kind of intense period of work. And then we have the hearings starting from November 11 going through until December 23. So the first week of hearings will be what's called viewings, where we're out in hospitals with the Industrial Relations Commission and we're observing work in practice. So watching how a radiation therapist works on a linear accelerator and seeing that day-to-day work. And then for the following 5 weeks or so, there will be in-court sessions where witnesses will be cross-examined and that will be conducted up until December 23. Then there'll be a bit of a break, hopefully a bit of a rest for everyone, and then we come back in February for closing submissions where barristers for either side will be putting on the kind of final arguments to put the icing on the cake for the respective cases. During this period, for the next few months, there is a lot of work still to be done. The Secretary has provided the HSU with some formal positions around a range of classifications, and there's about 5 or 6 different occupations where we'll be starting a consultation process imminently with those members to assess the view of the membership, seek endorsement or amendments, and respond to the Ministry around that to make sure that we move the case forward for those groups. So those groups are Aboriginal health workers, clinical coders, dental prosthesis, directors of Allied Health, also mortuary technicians.
So I guess next steps now is re-engagement with the membership. We've gone from 6,000 members through to virtually 12,000 Allied Health members. So members have come on this journey with us. It's not unusual to think that where is it all up to? So the next steps for us is now to be out amongst the membership, bring them up to date. So there'll be a range of visits over the current weeks to a range of hospitals.
Yeah, absolutely. So over the next few weeks, we'll be working to get out on site, have member meetings, updates, but also there's an important campaign lens to this. So if we learnt anything from the 2000s and particularly the health professionals award reform that occurred then, good outcome. One of the things that occurred and members are cognizant of and raise all the time is that After that, there was then, trouble getting funding, and there was, restructuring to afford it. So one of the things we're really mindful of is saying to the government, we've agreed to this process, we've agreed to go through the IRC. What we want from you is a commitment to fund the outcomes of this case. And so that's really critical, and that's what the focus of this next period will be with the membership, bringing that campaign back into the fore after a quieter period on the campaign front, and demanding of the government that, we've agreed to this process, it's the right way to do it, we've engaged properly, we need you to commit to funding the outcome, and not having a repeat of the 2000s where you get a good outcome and then the government turns off funding for key positions.
Now, look, and that is a fundamental issue that has to be addressed. And Mr. Mookie, we will be talking to you about that. This is a program that's been going for 3.5 years. Allied health professionals made sacrifices in 2023. And over that period of time, they have started to build and campaign and deliver one of the best litigious programs I've ever seen. The union itself now is putting in $1.2 million to see this through. And so it is going to be very important for not only our members, but the government. And on the back of the SCOE, the Special Commission of Inquiry, which recommended that this happens, that this actually gets realised. So I'm very confident that a lot of work has been done, not only by our people internally, but our delegates and the wider movement to be able to achieve an outcome before the courts, which the courts have said are exemplar. And I really do appreciate that. So we're working the right way, and at the end of it, when we get to a point of landing, we need the government to be able to stand by us and be able to fund the outcome. Thanks everyone for listening. We will keep you up to date, and over the next coming weeks, please make sure you attend the meetings that we have on site, and we'll be able to give you a lot more information then. See you later. Bye.